The Democratic Nursing Organization of South Africa is this morning leading a march to voice the health workers' grievances in Gauteng. These include the exploitation of community service nurses and other matters that we will be exploring now with the DENOSA spokesperson, who is on the line with us to give us a sense of the plan for the day, Provincial Chairperson Simphiwe Gada, who joins us now. Very good morning to you. Thank you so much for your time. Civil society, we know that you have said that enough is enough. You're taking to the streets in protest against workers' nursing conditions. What will you be ventilating?
Well, thanks, Sue, and good morning to the viewers. Let's appreciate the opportunity. Yes, indeed, it's all systems go today. We are gathering outside Kosatu House. Now we have started gathering, and then at 10:30 we envisage that we should be moving to the Gauteng Department of Health, Treasury, and as well as the Office of the Premier. We'll be handing a memorandum to these three departments. What we are calling for specifically to Treasury is to stop with the budget cuts that are aimed at health and also allocate more funding to health so that health can be able to meet its demand as far as health is concerned. We also want a firm financial commitment that the current cohort of nurses who are doing their community service, come the 1st of January 2023, they shall be employed permanently, because we know that we've got huge nurse shortages in the system. Secondly, as we go to the Premier, one, the Premier is the head of government to also give us this commitment in writing and also to resolve some of the challenges. In our memorandum, we have cited issues. We are calling for investment in nursing as well as the healthcare, because money that is spent on nursing should not be considered as an expenditure, but rather as an investment, because it has got positive spin-offs for the growth of the economy. In the Department of Health, we will also be handing a memorandum where we are demanding that those responsible for not paying nurses, there must be consequence management, in particular the CFO. We are also calling for improvement in terms of working conditions, the infrastructures. You would know, Mpo, that in 1996, this government took a decision to close Kempton Park Hospital. We are also calling for the re-establishment or the reopening of Kempton Park Hospital, because if you go to Ekurhuleni, especially in the north, you've got one hospital, which is Tembisa Hospital, which must cater for the population of Tembisa, Alexander, Diepsloot, and Edenvale and Kempton Park. And simply that hospital is not coping. And the challenges that we see in that hospital, it is our view that they stem from the lack of hospitals in the northern region of Ekurhuleni. So we'll be calling for these issues to be addressed, but also there's what you call a performance bonus that is owed to workers. 50% of it was paid, and then there's a remaining 50%. And workers have told us that they need that money because you'd agree with me that the rising fuel prices, the rising electricity prices, and the food prices are impacting on the livelihood of nurses. So nurses are saying it's enough. They demand what is due to them. So we will be handing over these memorandums, but we're also going to share our memorandums with the public. This is part of us saying to the residents of Gauteng that all is not well within the Department of Health, all is not well within the Gauteng provincial government. That is why we have elected to take this decision that we are going on the streets, because there seems to be a narrative that once these salaries are paid, these nurses must just move on. You'd understand, some of these nurses are young, they are now blacklisted, some of these nurses have had their cars repossessed, and some of them have been kicked out of their apartments because they simply could not pay rent, and all because of the Department of Health. So we are raising these grievances.
Simphiwe, if you'll allow me to just interrupt you there. 2 weeks ago, you revealed that the young nurses who were doing mandatory community service under the employment of the Gauteng Health Department had even gone more than 3 months without pay. I know that you've since engaged with the department and even brought the matter to the attention of Premier David Makhura. What difference in response are you hoping to get as you take to the streets today?
Well, we have received some difference in that some of these nurses have been paid, but not all of them. And now it is going to the 4th month that some of these nurses have got to go on without a salary. That is why we have taken we are taking to the streets to say this matter is serious, and those who are in government, who are in the management, seem not to be bothered. They are not treating the matter with the urgency it deserves. It had to take us to engage the Premier for the movement to start happening. So that is why today we are on the street to say we demand that within 5 days, all those nurses who are outstanding their salaries must be paid. We have submitted a list of those nurses and we want them to be paid, but also to address these other challenges. So yes, indeed, we are getting, positive results out of the stance that we have taken. That is why we are intensifying the action that we are taking, because part of what we are doing is to restore the dignity of nursing in this province, because there are those within the system who simply do not regard issues of nurses as important or as urgent. So, and this thing of nurses not getting salaries is impacting on their dignity, because imagine being a healthcare professional that cannot afford the necessities such as, toiletries. These nurses have had to go back home and ask their parents to assist them with money. So that is why we are saying we sympathize with them. We've been assisting with them. And today we have taken to the streets so that the residents of Gauteng, the entire country, must see what a disgrace this government is doing to young people who have just joined the profession.
And also what doesn't make sense is that the health sector is already on its knees, battling with shortages, and there's also been a dramatic rise in cases of patient negligence in Gauteng's public hospitals, which have jumped from around 4,000 to 6,900, which was recorded last year. I mean, that points to a 47% increase over the past year. Who should be held accountable?
Well, the HOD in the Department of Health is the accounting officer, but also those that account to her must be held liable. But also, we think that the head of government in this province must also, take some of the blame, because this talks to poor planning in terms of government. So, and the human rights also must also intervene and check to what extent has the government contravened the rights of citizens in this province as far as neglecting the healthcare system in this country. So government must take the full blame as far as this issue is concerned.
Very well. Thank you so much for your time there. Let's leave it there for now. Speaking to DENOSA Gauteng Provincial Chairperson Simphiwe Gada, detailing the finer concerns when it comes to why nurses are taking to the streets today.